Hi, this is Dr. Martorell. The topic is sexually transmitted infections or STIs. Sexually transmitted infections or STIs are infections people can get through sex. They are also called sexually transmitted diseases, STDs. Most STIs are caused by bacteria and viruses. Some are caused by parasites. The most common STIs include gonorrhea, chlamydia, Mycoplasma genitalium, genital herpes, also called herpes simplex virus or HSV, genital warts, also called human papilloma virus or HPV. Some types of HPV can cause cancer of the cervix, penis, and anus, hepatitis B, syphilis, trichomonas, human immunodeficiency virus, or the virus that causes AIDS. Many of these infections can spread through any type of sex. That includes vaginal, anal, and oral sex, as well as other types of sex play. HIV and hepatitis B can spread in other ways, such as exposure to body fluids. Other common infections can spread through sex. These include hepatitis A and hepatitis C, Zika virus, Neisseria meningitidis, Neisseria infections, or bacterial meningitis, especially in men who have sex with men, Mpox, also known as monkeypox. It is a viral infection that can spread through close contact, including sexual activity. Screening means testing for STIs in a person who does not have symptoms. Screening is very important because some people may have an infection and they do not even know because they have no symptoms at all. A person can have an STI and not know it and then be able to transmit it to someone else. People should be screened for an STI even if they are healthy or even if they feel healthy. The person can get treated right away, prevent transmission to another person, but also prevent complications to their own health. Treatment may also help or prevent infection from getting worse. There are different types of screening tests for different infections. Most of the time, it will be a blood or a urine test or a swab. The provider will help you determine which is the best testing options. For screening, different tests are appropriate for different people, depending on the sexual activity and sexual habits. These are some general guidelines. All people, including teenagers, should be tested at least once for HIV. All females younger than 25 years who have had sex should be screened every year for gonorrhea and chlamydia. Females older than 25 who have sex with more than one partner and do not use condoms should be screened every year for gonorrhea and chlamydia. Males who have sex with males should be screened at least once for HIV, syphilis, chlamydia, and gonorrhea. This should include every body part that could be infected, including the rectum. Males who have sex with men or males should also be screened for hepatitis A, B, and C at least once. Pregnant people should be screened for syphilis, HIV, hepatitis B. They should also be screened for chlamydia, gonorrhea if they are younger than 25 or have more than one sex partner. Some pregnant people may also need to be screened for other infections based on their sex habits. All people who are affected by HIV infection should be screened at least once for hepatitis A, B, and C. They should also be screened at least once a year for syphilis, chlamydia, and gonorrhea. Females who are affected by HIV infection should also be screened for trichomonas. Males who have HIV infection, who have sex with males should also be screened at least once a year for hepatitis C. Transgender and gender diverse people should be screened based on their anatomy and sexual habits. Some people might need other screening tests depending on their sex habits and other factors such as symptoms. If you are unsure whether you should be screened and for what, you should ask your provider. Symptoms that you may watch for may include genital itching, burning, sores, or discharge, pain or bleeding from sex, any new or unusual vaginal bleeding, swelling and pain from the testicles, among other symptoms. The right treatment for an STI depends on the type of STI that the person may have. Treatments may include antibiotics or antivirals. Treatments may cure infection or keep it from getting worse. It can also lower the chances of transmitting the infection to someone else. Sexually transmitted infections can be prevented. You could use a condom every time you have sex. Avoid sexual activity if a partner or yourself have any symptoms of an STI. Get vaccinated. Some STIs can be prevented with a vaccine, for example, HPV, Mpox, hepatitis A, hepatitis B, meningitis. If the partner has herpes, they can take a medication called valacyclovir or Valtrex, which will lower the chances of passing the infection to another person. If your partner has HIV, taking HIV medicines will lower the amount of virus in the bloodstream. That can also help prevent spreading HIV to another person. They must take the medicine as directed. The concept is U equals U. Undetectable virus equals untransmittable virus. The partner can also go on PrEP, which includes either oral or injectable medicines to prevent acquiring HIV. There is also treatment to help prevent gonorrhea, chlamydia, and syphilis. Doxy-PEP does not work for everyone. If the person uses sex toys, it is best not to share them with anyone else and wash them between each use. It may help prevent some STIs. I hope this topic was helpful. Join and like my social media pages. Thank you.